Welcome back to Scalia.com. My name is Momo Sama, and today we are talking about the vascular system. And in this part of the lecture, we are going to talk specifically about the vasculitis syndromes, in which we're going to talk about the different types of the vasculitis syndromes as well as the description of the vasculitis syndromes. So starting off with the vasculitis syndromes, what is vasculitis syndrome? So these are inflammatory and often necrotizing or vascular lesions that occur in almost any organ. And they're usually mediated by the immune mechanism, most often immune complex depositions. So let's start off different types of vasculitis syndromes one by one. So first of all, we have the polyarteritis nodosa, also known as PAN. It is actually a systemic necrotizing inflammation of blood vessels, also known as vasculitis, affecting small and medium-sized arteries, especially the ones that are supplying the muscles. And they also typically involve the arteries of the kidneys and other internal organs, but generally spare the arteries which are supplying the lungs or the circulation of the lungs or the pulmonary system. In polyarteritis nodosa, there are actually small aneurysms, which are actually the dilations of the blood vessel walls, but they are strung like the beads of a rosary, therefore making a rosary sign, which is characteristic of the polyarteritis nodosa, and it is also an important diagnostic feature of this type of vasculitis. Now, what are the causes of the polyarteritis nodosa? The most important cause is actually chronic hepatitis B, because it is found positive in around 30% of the people who have polyarteritis nodosa. Infection with hepatitis C virus and human immunodeficiency virus (HIV) are all occasionally discovered in people affected by PAN as well. On the other hand, in children, cutaneous polyarteritis nodosa is frequently associated with streptococcal infections. Other than these conditions, the cause remains unknown and the remaining cases, and there may be causal or clinical distinctions between classic idiopathic PAN, the cutaneous forms of PAN, and PAN associated with chronic hepatitis. Now, here you can see the manifestations or the different type of patterns that results from polyarteritis nodosa. Specifically in the muscles, we can observe myalgias in around 50% of the patients, because in polyarteritis nodosa, the blood vessels supplying the muscles are usually involved. Similarly, the renal system is also involved with hypertension in around 70 to 80% of patients with polyarteritis nodosa with renal artery vasculitis as well. Similarly, 30 to 50% of individuals with PAN also have mesenteric vasculitis or intestinal angina. Arthralgias and arthritis is also a very common manifestation in around 50% of individuals with polyarteritis nodosa. And one of the most important is the peripheral neuropathy in 50 to 70% of the cases. And in skin, we would observe palpable purpura and ulcers, which is a very characteristic feature because it can be observed in inspection without any diagnostic test being performed. So you can see there is purpura and there are also ulcers here as well. So this is actually a characteristic observation or inspective feature of polyarteritis nodosa on the skin. Moving on, we have the Churg-Strauss syndrome, which is an allergic granulomatosis, an extremely rare autoimmune condition or vasculitis. And this involves medium or small size blood vessels specifically, especially in persons with a positive history of airway allergic hypersensitivity, also known as atopy. And it usually manifests in 3 stages in such patients. The first is the early or prodromal stage, in which there is airway inflammation, and almost all patients experience asthma or allergic rhinitis. In the second stage, which is characterized by abnormally high numbers of eosinophils, which are characterized by inflammatory process or inflammatory response, which is occurring in response to any sort of allergen. So this results in tissue damage, most commonly to the lungs and the digestive tract. The third stage consists of vasculitis or inflammation of the vessels, which can even eventually lead to cell death and can be a life-threatening condition. So it is an autoimmune disorder, as you can see in this picture or chart. Inflammation of small and medium-sized blood vessels. Initial symptoms are breathlessness in 85% of patients, also characterized by asthma and chronic rhinitis. And it affects 4 per 1 million people in the US annually, and affects only patients with a history of asthma or allergy or symptoms of the pulmonary system. And symptoms include fever, cough, night sweats, weight loss, and breathlessness, and diagnosed by blood test, imaging, and biopsy. And treatment includes immunosuppressants, steroids, and cytotoxic agents. And the rate of death rate in severe form is as high as 46%. So it is a very dangerous and life-threatening condition. And complications include respiratory failure and inflammation of the heart muscles. And death is mainly caused by heart failure or gastrointestinal complications, as we can see in the previous slide, that it commonly involves the lungs and the digestive tract. Now we have the hypersensitivity vasculitis. Now that was the previous condition was because of the hypersensitivity of the pulmonary system. Now this is because of the hypersensitivity of the vascular system. So it is a hypersensitivity of vasculitis, which is an extreme reaction to either a drug, infection, or foreign substance, and it leads to the inflammation and damage to the blood vessels, mainly in the skin. So it can be observed and it would have a characteristic appearance on the skin, as well as we would see in the next slide. The causes are actually allergic reaction to drug or foreign substance or an infection, and it usually affects people older than the age of 16. Often the cause of the problem cannot be found even with careful study of medical history, and it may look like systemic necrotizing vasculitis, which can affect blood vessels throughout the body. But in hypersensitivity vasculitis, as we already discussed, it mainly involves the blood vessels in the skin. The possible complications of these conditions include lasting damage to the blood vessels or skin with scarring, and inflamed blood vessels affecting internal organs as well as it progresses. So you can see this is the characteristic feature of hypersensitivity vasculitis, because it involves the blood vessels in the skin, so it has a characteristic appearance on the skin as well. Now, another type of vasculitis is Wegener granulomatosis, which is a long-term systemic disorder that involves both granulomatosis and polyangiitis or polyvasculitis, which is the inflammation of the blood vessels. It is a form of vasculitis that affects small and medium-sized blood vessels in many organs, but most commonly affects the upper respiratory tract as well as the kidneys. The signs and symptoms are highly variable from patient to patient, and it depends on which type of organ is actually affected, or the blood supply of which organ is actually affected. The typical signs and symptoms, however, include nosebleeds, stuffy nose, crustiness of nasal secretions, and inflammation of the uveal layer of the eye. And it can also result in damage to the heart and lungs and kidneys, which can be fatal. So the symptoms: ulcerations throughout the oral mucosa, conjunctivitis in the eye, cavities, bleeds, and lung infiltrates in the lungs, stuffiness, nosebleeds, and saddle nose in the nose, and pericarditis, which is the inflammation of the pericardium in the heart, and nodules on the elbow and purpura, specifically you can see that in the skin, and glomerulonephritis in the kidneys, because it specifically involves the lungs and kidneys, as we discussed in the previous slide. Now we have the lymphoid granulomatosis, which is actually a viral disease. It is a rare Epstein-Barr virus-associated systemic angiodestructive lymphoproliferative disease, characterized by prominent pulmonary involvement, but can also involve multiple extrapulmonary sites as well. But majorly, it involves the pulmonary system and resulting in pulmonary angiitis, which means, or also known as pulmonary vasculitis, which means the inflammation of the pulmonary vessels, and granulomatosis. It mimics Wegener granulomatosis both clinically and radiographically, but it is different to that, and the pathogenesis, however, is unknown. However, recent studies have predicted that lymphoid granulomatosis is a distinctive type of malignant lymphoma associated with immunosuppression. And the diagnosis for lymphoid granulomatosis is based on a histological triad comprising of these three characteristic key features. One is the nodular polymorphic lymphoid infiltrate, composed of small lymphocytes, plasma cells, and variable number of large atypical mononuclear cells. Second is the vasculitis, inflammation of the blood vessels, specifically pulmonary vasculitis or pulmonary angiitis. And the third is granulomatosis. Now we have giant cell arteritis, which is also another type of vasculitis, and it is also an inflammatory disease. And symptoms may include headache, pain over the temples, which is this area, and flu-like symptoms, double vision, and difficulty while opening the mouth. The complication can include blockage of the artery to the eye with resulting blindness, aortic dissection, and aortic aneurysm as well. It is frequently associated with polymyalgia rheumatica, so the patient may experience joint pain in different joints or more than one joints. And the cause, however, is unknown, but the underlying mechanism involves inflammation of the small blood vessels that occur within the walls of the larger arteries. This mainly affects arteries around the head and neck, though some in the chest may also be affected. That is why we were talking about pain over the temples in the symptoms of giant cell arteritis. The diagnosis is suspected based on symptoms, blood tests, and medical imaging, and specifically it is confirmed by the biopsy of the temporal artery, which is the most commonly involved artery in giant cell arteritis. However, it is not absolute, and in about 10% of the people, the temporal artery may be normal under observation in the biopsy. So here you can see inflamed temporal artery as a characteristic feature of the joint cell arteritis, and that is also confirmed via biopsy as well, but it may not be affected and may be normal in about 10% of the patients as well. So we have to keep that in mind as well. Kawasaki disease, most commonly in children, and it causes inflammation in the walls of the medium-sized arteries throughout the body, not specific to any region, and it tends to affect the coronary arteries, which supply blood to the heart muscles or the myocardium. So it is very, very important to address this condition, and it is sometimes also called as mucocutaneous lymph node syndrome because it also affects lymph nodes, skin, and the mucous membrane inside the mouth, nose, and throat. The signs of the Kawasaki disease include high fever and peeling skin, which can be frightening, but the good thing is that it is treatable and reversible, and most children recover from Kawasaki disease without serious problems. Other symptoms include red bloodshot eyes, red cracked lips and red tongue, red swollen hands because it is a generalized inflammation or arthritis, high fever, red swollen feet, and rash involving much of the body because it is not specific to any one region, it involves the whole body. Now, another one is the Buerger's disease, also known as thromboangiitis obliterans. It is a rare disease of the arteries and veins in the arms and legs specifically, and in this condition, the blood vessels become inflamed, swell, and can become blocked with thrombus formation. Eventually, this leads to damaging or destruction of the skin tissues and may lead to infection and gangrene, and sometimes amputation may also be required. This condition is actually first shown in hands and feet, and then it may eventually affect larger areas of one's arms and legs as well. One important feature which is observed in the patients with Buerger's disease is that everyone diagnosed with Buerger's disease, virtually everyone, has an addiction of smoking and tobacco use in any form, or even chewing tobacco, and thus quitting all forms of tobacco is perhaps the only way to stop Buerger's disease. And for those who do not quit or who are unable to quit, amputation of all or part of a limb is sometimes necessary. So it is very important to stay away from tobacco consumption. So that was all about the vasculitis syndromes in the vascular system, in which we talked about the vasculitis syndromes, different types of vasculitis syndromes, and their description as well. I hope you learned a lot from it, and keep on watching scardio.com for more lectures. Thank you very much.